Dr. Judith Zackson is a clinical psychologist. She is based in Greenwich, Connecticut. Her private practice focuses on areas including depression, anxiety, panic attacks, relationship issues, parenting issues. The very first area I want to talk about in discussion with you, Dr. Zackson, is this idea of what has become known by the acronym PTSD, post-traumatic stress disorder. First of all, welcome to our program. Good morning. The term PTSD, or post-traumatic stress disorder, how do you explain what PTSD is?
Sure. So I think the first question is, what is trauma? Because post-traumatic stress disorder is following a trauma. So trauma, it's a human event. In neurophysiological terms, it's when your brain gets overwhelmed and it gets flooded with stress and memory that interrupts your regular functioning. So following a trauma, sometimes people have a hard time going back to normal functioning, and then is when post-traumatic stress disorder kicks in. The symptoms are when you have intrusive thoughts, you have images, you have nightmares, you have flashbacks, and it happens suddenly out of the blue, and it feels real. And it can really interrupt a person's way of being, and it's really scary because you don't have power over it. The other symptom is they have avoidance or numbing, meaning they don't want to go to certain events because it triggers them. They have a hard time being with their loved ones because they numb to the pain as a way to cope. And then the third symptom is hyperarousal. So any loud noise or any light or any scene that replicates the traumatic events takes them right back there as if it's happening again.
And when you talk about those who are, I guess, if I can phrase it, most susceptible to PTSD, who falls into that category?
I was thinking about that question a lot because you're really asking who are the ones that are most vulnerable and who are the ones that are resilient. What are the protective factors? But I think the big riddle is, why doesn't everybody get PTSD? If you think about it, you're in an event that you feel powerless, people are dying, it's chaotic. Everyone should really have PTSD. So why, if somebody that's not impacted by it is called resilient, right? Does not being sensitive, is that a bad thing? But the people that fall into it, that are more vulnerable, are the ones that experience prior psychiatric symptoms. So if somebody's had a lot of trauma, somebody was anxious before going into war, somebody who has had a depression before, so even though it's been treated, the likelihood of it coming back and being more vulnerable is higher. Similarly, on the other spectrum, if somebody has been pampered all their life, right, if you have these overprotective parents and you've never experienced any stress at all, then you have a very hard time dealing with any little stress, and it puts you over the edge. So the factors are twofold. If you've had too much trauma before or too little, then is when you're more vulnerable to getting PTSD.
And does PTSD play out or manifest in the same way in everybody?
Oh, everyone is very unique. We're all such different animals. So for everyone, it's different. One person can become extremely angry and abusive when they come back after war. We call it identifying with the aggressor. And some people become numb and very quiet, and they become depressed. So each person will display different symptoms according to their unique personality.